Welcome to Module 4, KNH 329, Patient-Provider Relations. Thus far, in Module 1, for example, we covered philosophies such as biopsychosocial versus biomedical, what is wellness. In Module 2, we covered motivation and health behavior change, where we investigated a little bit of self-determination theory, trans-theoretical model. In Module 3, we investigated the idea of chronic illness and quality of life, as well as the essence of pain, and a little bit on the placebo effect, which kind of led us into this idea of you can't get away from the humanness of healthcare. It's everything. No matter how much technology, no matter how much biomedical progress we may make, it ultimately comes down to this relationship that is established between the provider or the healthcare professional and the patient or the client. So that's what we're going over in Module 4 with this first lecture. I don't know if I can just do this in one lecture or two. But the quality of a patient's or client's experience is determined by two things: the relationship with the provider, that may be you, or you may be a patient or client at some point, and two, the patient or client's interaction with the environment. This could be primarily the physical environment in terms of the setup of a hospital or a room, or even the outdoor environment, as well as the social environment in terms of that dynamic interaction between healthcare provider and patient or client. Now, your patient interview paper focuses on these two components: the relationship and the interaction with environment, and you can go to assignments and better understand that patient interview paper. Now, things are changing. For example, the KNH department is booming. When I first got here many years ago, we maybe had 300 majors. We're now up to about 14 or 1,500 majors. Why? Well, because of the virtual explosion of physician assistant, physical therapy, occupational therapy, health promotion, nursing, so on and so forth. And we do our best to try to prepare many of you for kind of the entryway into those kinds of professions, and even physicians. Some of our majors are go on and become physicians of many kinds: chiropractic, OD, MD, and so forth. A lot of issues impacting quality of care, and ultimately that's what we're supposed to be about, right? Is quality of care. First of all, the healthcare plans have really changed, and they're really beginning to get into the game in terms of dictating what and how doctors deliver care. Talk to any primary care physician or surgeon or whatnot. There's lots of protocols that have to be followed now, so it's very complex. You got HMOs or PPOs, health maintenance organizations, preferred provider organizations. For example, at Miami, I'm in a traditional plan, a preferred provider organization plan. You've got the Affordable Care Act, right, i.e. Obamacare, which has really created a lot of havoc, or wreaked havoc, on our healthcare system, at least initially. Will it get better? Hopefully. There's little continuity in care right now. Care is very fragmented. Now, that shouldn't be surprising since we're driven by a biomedical model, right? So the biomedical model really doesn't integrate much. So that's why we have all these specialists, and it's all fragmented. And if you have a problem, you end up going to many different specialists, right? Again, that's good or bad, depending on how you look at it, I guess. A lot of long waits, short visits. Again, I know a little bit of this. I've been in a lot of doctor's offices the last 4 or 5 years. Some of you probably know people who have as well. It's no fun. And the average visit with a doctor is 12 to 15 minutes. That's probably stretching a little bit. It's probably not even in that much, unfortunately. We wait in the doctor's office more than we actually meet with the doctor. Treating patients, now we're getting into what's called diagnostic-related groups. Diagnostic-related groups, or DRGs. You can go to the reading and read more about it, or Google diagnostic-related groups. A whole world will open up to you about what that's all about. But basically, it's homogeneous in that patients are categorized according to biomedical criteria, according to disease and condition, and doctors and hospitals have to follow the guidelines that are set in terms of treatment. it's very much a biomedical orientation. And so DRGs really disregard psychosocial interaction or psychosocial issues. And the bottom line to a lot of this is physicians are no longer solely in charge of care. Hospitals, insurance, certainly now with Obamacare, these entities or organizations are very much involved in the charge of care. So the physician, as this kind of king or queen sitting on a throne making decisions independently of a lot of other things, is really no longer in place. There's a lot of things that go on into a lot of things that doctors do, as well as healthcare professionals, not just to pick on hospitals or doctors. So lots of things happening in our healthcare system. That's kind of a pro and a con. In some ways it's good because I think there's lots of room for young professionals to make their mark and gain entry into a lot of different kinds of positions now in healthcare. Hospital administration, healthcare administration, people who really know what's going on. Some of these kinds of positions have opened up, and I'll finish a little bit more with some healthcare positions in either this lecture or lecture 2. So holistic health has helped somewhat. So there have been some good trends in terms of holistic health has helped somewhat to create more of a partnership between doctor, patient, healthcare professional, client, but also more challenges because think about it. People are armed with information now because of the internet. WebMD or all of these sites have information about various conditions and symptoms and self-diagnosis and, you know, do we take this herbal medicine compared to traditional prescription drugs, right? There's all kinds of things going on, but complementary and alternative medicine really is part of this whole holistic movement, and that has added another layer of complexity onto both diagnosis of certain conditions as well as treatment. So again, doctors, healthcare professionals have to be on their toes because lots of people are coming to them with many different kinds of ideas relating to their issues or problems. Lots of things happening. You can kind of decide good, bad. I'd say in general good, but we still got a ways to go. Now, as far as communication, that's a big part of reading number 8 in terms of patient-provider relationships. Physicians don't listen very well in general. They interrupt and are interrupted. In fact, they're interrupted often by drug companies. I was reading somewhere where drug companies are beginning to tone down this relationship that they've attempted to create with physicians. It started to be getting looked by the American Medical Association, and so that relationship is starting to wane a little bit, which I think is a good thing. So doctors can actually do their job. Patients come in with more knowledge, as I talked about with complementary and alternative medicine. There's a lot of social networking, the internet. There's a lot of video that I have up on NECA under resources for Module 4 under Module 4 videos. Lots of things going on with e-patients and electronic medicine, concierge medicine, which is using a lot of the internet. Lots of things happening. So you need to really, this is purely kind of tip of the iceberg, so to speak. You really need to kind of keep your eyes and ears open as to what are the trends that are going on. But if you're going to work in healthcare, you got to realize patients are coming to you with not necessarily more knowledge per se, but certainly more information. Sometimes in communication, physicians, healthcare professionals, they use a lot of either complex jargon, meaning too highfalutin language, or too simplistic or baby language, so to speak. So you kind of have to know who you're talking to. Sometimes this is also just a little bit below here in terms of immigration. It may not be communication issues in terms of complex or simple language. It just may be different language, right, in terms of understanding that. So this whole health disparities due to immigration is only going to probably get worse. So if you want to get another, learn a second language, I highly recommend that you learn a second language because it'll make you highly marketable in terms of healthcare positions. Another issue is non-person treatment or depersonalization. This has been going on for many, many years. In fact, the movie Patch Adams, which serves as the grounding for your personal connection paper number 4, of course, it's a little bit dramatized, of course, because it's a Hollywood movie, but Patch Adams is a real person, and you can find out a little bit more about that in the assignment when you get to the personal connection paper number 4, but you'll need to watch that movie starring Robin Williams. And it gets into a lot of this ideas about depersonalization really comes from the biomedical model, and that it didn't want physicians to kind of have empathy with the patient or client, because that could bias the objectivity. Again, this is changing, but even as 1960s, 1970s, depersonalization was deeply embedded in a lot of healthcare. Slowly changing, but still there. As I talked about, stereotypes in immigration also lead to poor communication. And again, with the onset of greater immigration occurring, for example, with Hispanic Americans, they're now the largest minority. We need to know how to communicate with them. Also, patients can contribute to poor communication. Typically, patients come in, there's something wrong, they want an immediate diagnosis, right? Like right now, they want everything solved, whereas you need to kind of, healthcare professional or a physician needs to kind of take a step back, really be thorough, and take their time to kind of ultimately come to a diagnosis. And let's face it, some of these conditions, especially like with cancers or autoimmune conditions, they're difficult to get a diagnosis. So it's not easy. And if you've got a lot of these communication problems going on, it gets even more challenging to kind of figure out ultimately what might be the diagnosis and ultimately treatment. Now, what are some of the results of this poor communication? You could probably figure out some of it in terms of patients just don't adhere to treatment because they don't always know what they should be doing. And my pet peeve is that there's minimal follow-up. So be careful, for example, if you go in for testing or screenings, sometimes people assume because they don't get a call that everything is okay, and I'm not trying to create hypochondriacs here, but you got to follow up, unfortunately, because sometimes the medical system is so screwed up at times that you can fall through the cracks and there's no follow-up. And I've had personal experience with this as well. So no follow-up, patients don't know what to do. 85%, this is one of the pre-course quiz questions, 85% fail to adhere to prescribed medications. So, and a lot of people are taking multiple medications, so you have all these interaction problems, and of course technology suggests that they can solve these interaction problems, but very difficult. And ultimately, malpractice claims and poor adherence are a result of some of these communication issues between healthcare provider and patient or client. People sue doctors sometimes not because they're incompetent, but because they feel like they weren't provided the right kinds of care in terms of how the doctor may have communicated. So doctors are learning a little bit more about this, mainly to kind of protect themselves somewhat from malpractice claims. So the listening circle, that's another one of your learning experiences. You have to do that kind of with folks in your homeland, so to speak, but you can look that up on the assignments, and you can find out a little bit more about the learning circle, and you kind of will describe a little bit of what you thought about that. It's kind of one way, my way, may not be the best way, but my way of trying to get you to think a little bit more about the importance of listening and how you listen. As far as good communication, I've talked a lot about the bad. I think what I'll do is I will stop here since we're at about 14 minutes. And when I come back to lecture 2, we're going to get into what is good communication, and we'll get into the importance of the physical and social environment. Remember, the relationship you have with the patient or client is significant, as well as the relationship the patient or client has with the whole environment. This could be the hospital environment or a medical office or whatever it might be. Environment has a very significant impact on our health and well-being, as well as our healing. So that's the end of Module 4, Lecture 1, and we'll see you in a little bit.